Good evening, all. Today, in our Cancer to Canwin talk show, we have Dr. Sanjay Kumar Yadav with us. Dr. Sanjay is an expert in breast cancer, thyroid surgery, and endocrine surgery from the oldest and most prestigious department of endocrine surgery at SGPGIMS Lucknow and Johns Hopkins, USA. Dr. Sanjay has keen interest in research work and has published more than 50 research papers and awarded by many prestigious medical bodies. An expert in oncoplastic breast surgery, breast conservation surgery, advanced chemotherapy for breast cancer, vacuum assisted breast biopsy, and treatment of breast lumps without incision, USG guided biopsy, endoscopic thyroid surgery, laparoscopic adrenal and metabolic surgery. Welcome, Doctor, to a talk show.
Hi, thank you, Ashwini, and thank you for inviting me for this talk. And obviously, cancer is a very big problem in our country, especially in women and especially breast cancer. So, lot of advocacy is needed in this field. So, thank you for doing that.
Thank you, Doctor. It's my pleasure. So, the first question to you: what inspired you to choose this field of oncoplastic breast surgery, thyroid, and endocrine surgery?
Okay, so when I was doing my general surgery residency, MS in at 𝐸𝐴𝐺𝐻 Ranchi, so we used to see a lot of patients with breast cancer, but most basic facilities were also not available, nor we were trained to do the advanced procedures like sentinel lymph node biopsy and all. And these were patients who belong to very poor economic conditions, and they could not travel to big institutions like Mumbai or New Delhi. So we had to provide whatever resources we had. So that I think that led me to further training, and I thought, okay, I can train myself in this field and help these patients. So one of the reasons for that.
That's really great service to humanity. So, I mean, why did you, especially the oncoplastic breast surgery, you're an expertise, you're specialized in that. So, why did you choose the oncoplastic breast surgery? And please tell us more about it.
Okay, so as the cancer management for breast cancer evolved, so the cure rate also changed dramatically. In Western countries, out of 100 breast cancer patients, 98 are fully cured. Only 2 patients die due to it. Whereas in our country, approximately 40 to 50% women die of breast cancer after the diagnosis. So, the basic problem is because our patients present in very late stage. So the thinking has become that okay, once cancer is detected, you have to take it out. You have to remove whole breast. But that is not so. Currently, it has been seen that those patients in whom the breast is preserved and conserved, those patients are very happy with their outcome. Their quality of life is very good, and they live longer than those patients who undergo mastectomy for breast cancer. So currently, the breast cancer is divided basically into 3 groups: early breast cancer, locally advanced breast cancer, and metastatic breast cancer. So the early breast cancer, for early breast cancer, the standard of management in all developed countries is breast conserving surgery. So, but unfortunately, in our country, this procedure is not offered to most patients who can be offered these procedures, even if they present in early stage. So, the oncoplastic breast surgery is basically a type of breast conserving surgery. In breast conserving surgery, we remove only cancerous growth and the normal breast tissue around it. In oncoplastic breast surgery, we do that procedure. We remove that cancer with normal breast tissue, and then we combine another procedure of plastic surgery to fill that defect so that the normal shape of the breast is maintained. So that is the basic principle of oncoplastic breast surgery. So we are conserving the breast, and also we are trying to maintain the normal shape of breast as possible as we can. So that is oncoplastic breast surgery, and it has been found that the outcome of oncoplastic breast surgery is very good with regards to quality of life of patients. Those patients are very happy. So that is basic principle behind oncoplastic breast surgery.
That's really great. Actually, the women they feel more confident, like when the entire thing is not removed, part is not removed, because they sometimes they feel very bad to go out and they feel low of themselves. And I think this onco, and I believe like oncoplastic is definitely a, it will be a big boon for them to
Yes.
face the outside world with more confidence and everything.
Yes, so earlier, as soon as a patient comes to know that she has a breast cancer, obviously breast cancer is most common in women in our country. So as soon as they come to know that they have breast cancer, they will tell immediately, okay, remove whole breast. Most of patients think like that because they
Yes.
think that removing whole breast will save them. That is true. Obviously, removing cancer is one of the treatment policies for breast cancer. But as I said, these patients can be cured. That means they will live their normal life. Like some patient is 50 years, so she will live up to 80, 90 years. So immediately after diagnosis, they think, okay, removing whole breast is fine. But down the line, after 5 years, 10 years, then they start thinking, oh, I could have undergone oncoplastic breast surgery, my breast could have been preserved. So that feeling starts after some time. Once they think, they know that they are cured. So in some way, breast cancer is like some other chronic diseases only. So very few patients die of breast cancer if it is detected early. That is why they should be offered a conservative management only, because they are going to live their normal life. So we should try to provide the normal aesthetic outcome for the breast.
It's really, I mean, it's really helps them, as you said. So my next question, tell us, like I have seen, like you have also mentioned, like you are, I mean, it has been mentioned like you're expert in surgical economics. Can you please tell us more about it? What is that actually?
Okay, so surgical ergonomics is basically for the well-being of the surgeons, right? Like surgeons keep on operating, then they start getting neck pain, backache, and heel pain. So, like I am member of Society of Surgical Ergonomics USA, which was formed last year only. So we have been trying to teach our young surgeons, the general surgery residents, like how they can inculcate good habits from the beginning only, so that they should not have these problems, chronic problems later on in their life. So that is like a part of educational activity for young surgeons.
Okay, okay. Like how they have to maintain that ergonomics,
Yeah, yeah, how to maintain their posture while operating,
posture
how
to be
to,
fit.
yeah, yes.
That's great. So, when is the breast surgery recommended? So, it's mostly occurs in women. I mean, many women are being affected. Like, I got to see your statistics. As per the statistics, like um, out of three, like one woman are being affected. It's so much prevalent in throughout the world. So, when it is actually recommended, so can is there any possibility like without the surgery, can the breast cancer be cured? Or is surgery is a must to cure that when it is
Okay.
recommended actually?
Yeah, so to understand the problem of breast cancer, as you said rightly, that 1 out of 3 women are afflicted by this disease during their lifetime. And one woman dies of breast cancer in every 8 minutes in India. So, so big is the problem. and it is number one cancer. If we combine both male and female population, then also it is number one cancer. Earlier it was lung cancer, but now the breast cancer is most common cancer. That is why more awareness is required so that patients can present in early stage and they can be cured of the disease. As I said, it is one of the cancer where there is a cure available. So, so how to cure this breast cancer? So there are three basic things which are required for the treatment of breast cancer. One is surgery, second is chemotherapy, and third is radiation therapy. Almost in India, in our country, almost all patients require all three things. The sequence may be changed. Some patient may require chemotherapy before surgery. Some patient may require chemotherapy after surgery. So in almost all patients, all these three things are required. And yes, surgery is one of the most essential part of the breast cancer treatment planning. uh, if it is early breast cancer, as I said, so early breast cancer is when the breast lump size is less than 5 centimeter. So when it is less than a size of orange, then and there is no lymph nodes in axilla, then patient can straight away be offered surgery, and after that chemotherapy and radiation therapy. But when the disease is more advanced, which is called as locally advanced breast cancer, in that situation, first chemotherapy is recommended. So after chemotherapy, this lump becomes smaller in size, then we offer surgery to the patients. And breast conserving surgery or oncoplastic breast surgery is possible in both early breast cancer and locally advanced breast cancer. So yes, surgery is one of the most essential parts of treatment planning of breast cancer.
So when it comes to breast cancer, I think it is mostly recommended. Like it is a must when compared to other
Yes,
cancers, right?
yes, yes, yes.
Okay. So in the women, like in women, how to identify the breast lumps? Like as you said, if the if we come if a person has a lump which is lesser than a size of the orange, you said like it is much easier to uh, operate, and also it must easier for them to recover. So how to identify that at the initial stages itself, so that they can also approach the hospitals at a very early stage.
Yes, identifying any breast lump in early stage can save many life in our country. As I said, most of our patients present in advanced stage, so their lump size is bigger than an orange size. You can just think when a lump is approximately a size of a small lemon size, then in that case, the chance of cure is more than 95%. But when that lump becomes a size of an orange, then chance of cure decreases to 80 to 90%. So that is advantage of detecting a lump in a small size. So when a lump is of a size of a small lemon, it will not be seen. You cannot see it in the breast, but you can feel it, right? So that is the recommendation for identifying any breast lump. All women, especially above 30 years of age, should have a monthly breast self examination. Okay, so what is breast self examination? So once in a month, preferably after 1 week of periods, after taking bath, women has to stand in front of mirror and then inspect or see both breasts and palpate with the flat surface of the palm fingers, right? So they have to palpate with the flat surface, not like this. So they will feel lump everywhere. So palpate with the flat surface of the fingers, and if they find any lump, any abnormality, so every woman's breast is of different kind, right? So first they have to know what is normal for their breast. So for that, after 2-3 breast self examination, they will come to know, okay, this is normal for my breast, this is normal. So once there is any abnormality, they can feel it, and they can approach the any expert breast surgeon for uh, what we call as clinical breast examination. So that time doctor can examine and tell whether that abnormal feeling is right or wrong, and advise any investigation. So one thing that we can advocate to all women above 30 years is breast self-examination every month.
Okay. That is really, it's a great awareness which you have told. It's essential for women above 30 years. Like those who are watching this, like they would have definitely got a great, an understanding about how to identify and how to self-examine it. So, there are sometimes like the lumps may occur out of the body heat. When to have a doubt actually whether it is a cancerous malignant lump, because sometimes there would be chances like women may get lumps out of because of a body heat or some other reasons as well. So when should
Okay.
be women be suspicious of it?
Okay, so you rightly said that women can have breast lumps. Breast lumps are frequently very common in all women, right? So the non-cancerous lumps, which are called as fibroadenomas or fibrocystic disease, and then there are cancerous lumps. Okay, so so to differentiate between these two, it is always better to get an expert opinion. But there are some pointers which can point, okay, this lump is slightly towards one side or slightly towards the other side. So one of these pointers are when the breast lump is progressing, the size is changing very frequently. It is increasing very rapidly. Like on first month of examination it was small pea size, the next month it suddenly became a small lemon sized lump. So that way, that time, women should get alerted and consult an expert surgeon. Another feature is when this lump is like not painful. Okay, so usually cancerous lumps are initially they do not have any pain, so that is also one of the signs. Then there could be skin changes and all this. So these are just pointers, but any lump could be cancerous. So it is always better to get an expert opinion whenever you detect or whenever feel a lump. It is always best to get an expert opinion, and then only proceed as per the advice of the expert.
Thanks, doctor, for that clear explanation. So, as per the statistics we have already, as discussed, like the breast cancer is the most common, right? So, how can women prevent breast cancer? What are some of the ways like it can be prevented?
Okay, so like there are few risk factors which increase the chances of breast cancer. So and they also increase the chances of other cancers, but it is not proven that if you totally avoid them, you can prevent breast cancer. Right now, all we can say is breast cancer is total. It cannot be totally prevented. There will be some risk of breast cancer for each and every woman, but these tips, lifestyle changes may decrease that risk. So basic things are like smoking. Smoking increases the risk of all cancers, so it also increases the risk of breast cancer as well. Alcohol consumption is another factor. Then uh, active lifestyle, like reducing one's weight and not eating lot of oily and fatty food. And another point is breastfeeding is one of the known methods of decreasing the risk of breast cancer. So those women who breastfed their infants, they have lesser risk of breast cancer than those who do not. So these may reduce the risk, but it cannot be totally prevented.
Okay. So, like, what are the different types of breast surgery, doctor?
Okay, so as we have discussed somewhat, so breast surgery for breast cancer is basically three types. One is what is called as modified radical mastectomy. So in that surgery, the whole of the breast is removed, and along with axillary lymph nodes are removed. And second type is breast conserving surgery. Breast conserving surgery is basically when we remove cancerous growth along with normal breast tissue around it. And oncoplastic breast surgery, when that breast conserving surgery is combined with some plastic surgery techniques so that the normal shape of the breast can be maintained. Apart from that, there are many reconstruction techniques. Like for some regions, we cannot do oncoplastic breast surgery in all women. So, like those women who have hereditary breast cancer or genetic breast cancer, so they have lifetime risk of developing breast cancer. In those patients, we remove whole breast and then a breast is reconstructed by using implants and autologous some muscle flap and all. So all these are procedures which can be performed on breast.
Okay, doctor. So, in the what way the oncoplastic breast surgery builds the confidence in women? Like as we have already discussed, like women they feel a lot more depressed and feel bad when, especially when it comes to breast cancer, because when it involves other types of cancer, they don't feel like a body part is missing. But this is like more like it reduces to confidence of women. So how do they feel, and how do they deal? How can they deal with it actually?
Yeah, actually, so now there has been lot of research, lot of data is there, lot of studies are there that has proved that that women who undergo oncoplastic breast surgery are more confident and have better quality of life than those patients who undergo mastectomy or who just undergo breast conserving surgery without any oncoplastic technique, because oncoplasty tries to maintain the normal shape of the breast. We try to maintain the normal shape of both breasts. So, in that way, patient will not feel that something has been done on the breast. So that itself boosts the confidence of the patients. So, and this has been seen in many studies which have been published that these women live longer and live happier than those who undergo mastectomy.
Okay, that's great actually. So when this has been, is it a recent thing, or the oncoplastic has been for so many years? How this actually? Uh,
Yeah.
I mean, how
So
many years it is being prevalent? Yeah.
yeah. So no. So in Western countries, it has been practiced, and it is one of the regular standard of care over there. But in India, this procedures, these procedures are usually not offered to all patients who could be offered these procedures. I still get many patients who will not agree for these procedures because they don't know. Because we require greater advocacy for this type of procedures, that no, it is a safe kind of procedure. So it in India, it started a decade back, maybe 15 years back. But still, the uptake is very low here. Like not lot of surgeons are trained for oncoplastic breast surgery, and apart from that, not many patients choose these procedures. So that is one of the hindrance in wider acceptance. It is well practiced in major cities and maybe Delhi, Mumbai, metro cities, then tier two cities like Lucknow, Jaipur, or Mangalore. But in other cities, tier three cities, and all, the uptake is very low. Similarly, there is procedure called as sentinel lymph node biopsy, which is kind of minimally invasive procedure to know if the cancer has spread to the axilla or not. So these procedures are also they have very less uptake. In fact, we only did a research on this, a survey of the practicing surgeons in India. How many of them practice oncoplastic breast surgery? How many of them offer oncoplastic breast surgery and sentinel lymph node biopsy to eligible patients? And the percentage was very less. Only 30 to 40% of patients are being offered these procedures, which is very less.
Okay, like as you said, the patients, I think they should have more awareness about what
Yes.
is this, and so I think they feel the patients have a feeling like whether it would be safe. Sometimes they may feel like removing the entire breast may prevent the reoccurrence instead of
Yes.
conserving it, right? Like they have that kind of notion.
Yes, yes. So in a way, that is partially true. The recurrence rate after breast conserving surgery is slightly higher, slightly, only 1 or 2% than mastectomy. But it is local recurrence rate, right, which can always be managed with another surgery. So I think there should not be any dilemma that those patients who are eligible, they should definitely get breast conserving surgery.
Okay, doctor. Now, like, are the patients they are given option to choose like what kind of breast surgery they want, or it depends upon their condition, like the doctors recommend it. How it is like
Yeah,
for example,
so
can they choose like whether they require oncoplastic? Are they given that option?
as I said that first it depends on the stage of the cancer and whether the patient is eligible or not. Like some cancers, their oncoplastic breast surgery is not possible. Like if it is hereditary or genetic breast cancer. But in all other cancer patients, it is almost always possible. So, once the patient is eligible for oncoplastic breast surgery, so we usually discuss both the options. Okay, you have early breast cancer or you have locally advanced breast cancer after chemotherapy. Now, you can go either mastectomy, removal of whole breast, or you can undergo oncoplastic breast surgery. Then we discuss all the pros and cons of both the procedures. Like radiotherapy is always mandatory after oncoplastic breast surgery, and it can be avoided in some patients who undergo mastectomy. So it is always the choice of patients. It is always a shared decision making. It should never be the choice of surgeon. Okay, it is always choice of the patient, what she wants, and it should always be according to her wish.
Okay. So, as we already discussed, like you also told about the reoccurrence rate and everything. So, in general, what are the chances of reoccurrence of breast cancer? Is it like a person who has genetic breast cancer, hereditary? Do they have more chance of reoccurrence, or how it is like in general for a person?
Yes, so recurrence rates are very low and approximately 3%, right? 2 to 4%, but approximately 3%. Obviously, if any person has genetic breast cancer and breast has not been removed, there the risk of recurrence will be higher. But in other women, this risk of recurrence is very low. Okay, out of 100, only 2 or 3 patients will have recurrence. Again, this depends on many other factors like what was the primary stage of the breast cancer and age of the patients, grade of the cancer. But in general, we can say this recurrence rates are low, not very high.
Okay. So, it comparatively with other cancers, what is the recurrence rate of breast cancer actually?
Okay, compared to other cancers, breast cancer is now a curable cancer, right? As I said, in early breast cancer, over 97 to 98% patients can be cured. So, obviously, recurrence rate will depend on the type of the cancer. Like if we compare it to some lung cancer and head and neck cancer, oral cancer, then recurrence rate is very low in breast cancer. In those cancers, recurrence rate is very high, 30 to 40%. Here it is only 3 to 4%. So it is that is why it has become one of the curable cancers.
That is great. So thank you so much, doctor, for being here. And I think now especially the women, would have got a lot more clarity about uh, breast cancer, like how to prevent it and what are the different surgery options available, and how to self-examine. So much of information has been shared by you for the past 30 to 40 minutes. Thank you so much, doctor, for being here and spreading the awareness among women. It's really a pleasure to have you here in today's talk show.
Oh, thank you, Ashwini. The pleasure is all mine because we know greater advocacy for this as it is becoming number one killer disease in women in our country. So we need greater advocacy and people like you who are doing it, who are trying to educate the masses. It is a great effort, and I really thank you for that.
Thank you so much. Thank you so much, doctor, for
Thank you.
being here and for you. I think I know like you are busy, but you really wanted to serve the people, and you readily agreed for this talk show. Thank you so much for being here.
Thank you. Thank you.
Yeah,
Okay,
thank you.
bye.
Bye bye.